Have you ever noticed that your period blood is a bit of a brown color rather than the usual red? And maybe you're wondering if this is normal or what may be going on. The truth is that brown period blood is actually quite common. And there actually are a lot of things that could turn your period blood brown. So let's go ahead and take a look at what's normal and what's abnormal and when you should go ahead and speak to your doctor about your symptoms. Hi, if you're new to me, I'm Dr. Carmen, integrative doctor and health coach, helping you fix your period problems naturally. And if you're new to this channel and if this type of content is your jam, then feel free to subscribe and share it with a friend. So why is your blood sometimes brown during your period? Well, this is quite common, especially at the very beginning of your period or at the end of your period. And it's usually the time of your period when your bleeding is quite light. And usually this is a sign that it's taking a little bit longer for the blood to actually come down through the vaginal canal and actually be discharged from your body. So if you're experiencing some brown discharge before your period starts or as your period is kind of winding up at the end, this could potentially be normal. Brown blood, especially at the beginning of your period, may actually be a little bit of old blood that's kind of been hanging around and hasn't quite made its way out of the vaginal canal just yet. Another reason why you may be experiencing brown blood is because of something called oxidation. So when blood is exposed to oxygen, it tends to turn brown in a similar way to how a cut apple, if you leave it out on the counter for a few moments and it's exposed to the air, will also turn brown. That's the process of oxidation. So perhaps your blood didn't actually come out brown, but maybe it's been sitting on a pad for a while and it's been exposed to oxygen, then it may turn a brown color. Another situation where you may experience brown blood is after giving birth. So there's a discharge that usually lasts for about 6 weeks after giving birth, and it's known as Loia. Now, Loia initially starts off as like a red, almost like period blood type of thing. And then it kind of slowly begins to change over time, turning a brown color before it turns like a light yellow and eventually completely disappears. So Loia is also a very normal discharge that you can expect after you've given birth. So I'm sure you've noticed that your period blood can change in color, in flow, in texture, and that's because it's not just blood that's leaving your body. It's a combination of blood, the lining of your uterus, some mucus, and some bacteria. So sometimes a brown discharge or brown blood that's passed during the period or just before or just after can be completely normal. But sometimes a brown discharge may be a sign of an underlying health condition. And there are a few things that you need to take note of and kind of keep in the back of your mind so that if you notice any of these, you can take action. One example is some infections. So if you're noticing some brown discharge while you're on your period, then it could be a sign of an underlying infection. Conditions like bacterial vaginosis, yeast infections, and chlamydia, which is a sexually transmitted infection, can all potentially cause brown spotting. And so in particular, if you're noticing that your discharge is quite foul smelling, that you're having burning or itching or any kind of discomfort, then it's important to speak to your doctor about it. Another possibility is a hormonal imbalance. Conditions such as polycystic ovarian syndrome, endometriosis, and thyroid conditions can all impact the menstrual cycle. And some of these can even lead to very heavy bleeding, which may be associated with brown colored period blood. So if you're noticing that your menstrual cycle is irregular and perhaps you have some other symptoms such as unusual hair growth, maybe you're struggling with fertility, maybe you have severe painful periods, then definitely speak to your doctor about these. Another thing to consider is conditions of the cervix and the uterus. So conditions such as polyps or fibroids in the uterus, or even abnormalities of the cervix, including cervical cancer, can all potentially result in heavy bleeding and or a brown colored discharge. So it's super important to keep up with your pap smears and make sure that if you're having any associated symptoms, things like cramping, very heavy bleeding, irregular cycles, that you speak to your doctor to do further tests and explain to you what may be the underlying root cause. Okay, so as you can see, a brown colored discharge can be anything from just a normal variant to some serious conditions. So how do you know when to see your doctor? So the first is if you have any accompanying symptoms. So if you're experiencing any burning, pain, discomfort, if you're noticing that the discharge is offensive smelling, or even that you're experiencing a fever or pelvic pain or discomfort, these are all signs that you could be potentially sitting with an infection, and it's worthwhile speaking to your doctor about getting tested. The next thing to note is if you're having any changes in your menstrual cycle. So if you notice that you're skipping periods, or that you're bleeding or having more periods than you would expect to be having, or even if you're bleeding between your periods and somehow your menstrual cycle is either shorter or longer than you would expect, or it's all of a sudden become irregular or erratic, these are all reasons to speak to your doctor about an underlying root cause, because this may suggest some kind of hormonal imbalance that you could be tested for and diagnosed with. And then the third thing to look out for is a persistent, unusual discharge. So having a clear discharge throughout your cycle is something that we would expect. But if you are noticing that that brown discharge is persistent, so your period is done and you're still experiencing a discharge, and especially if that discharge is offensive smelling, and if you're noticing it for more than just a few days after your period is done, this is a sign to go and speak to your doctor about getting a thorough examination done, and perhaps even doing some further tests so that you can get tested for a potential underlying condition. So just to recap, a brown discharge can be a normal variant, and it's oftentimes not anything to worry about. But some red flags are if you're having additional symptoms, if your menstrual cycle has changed, and if that discharge is persistent, unrelated to your period. So let me know if this video helped and if you have any questions. If you found this video helpful, don't forget to like it, and feel free to share it with a friend who you may think it can help too. And if you're having period problems and you're looking for a more natural, holistic way of managing your period problems, especially if you are hesitant to go on hormonal birth control, or if you're coming off hormonal birth control, then check out the guide in the description box below. It's called Go With The Flow, and it's a guide that can help you understand the different phases of your menstrual cycle and how to live in harmony with the ebbs and flows of your hormones, rather than fighting against your period problems. And thank you so much for being here. If you haven't yet subscribed, please go ahead and do so that you don't miss the next video, and I'll see you in the next one. Until then, take care of yourself.